Dr. Sahar Lashin, integrative doctor. I had my passion in integrative medicine because of personal experiences and because of my patients as well. So my patients pushed me towards the integrative way when I was a very, very classic doctor. I have been a teacher for more than 25 years, teaching medical students, and I was teaching nurses as well. A faculty member in Cairo University for 18 years as a GI and liver doctor, had my master's and PhD in GI and liver and infectious disease, tropical medicine, and then moved to the US where I got my board certification in internal medicine, working with the experience from Africa. Together with the American experience, I got a lot of difficult patients who just were seeking advices outside the box. And that's when I was introduced to the love of integrative medicine, since most of the patients don't want anymore a script on a paper and out of the door. They need somebody to talk to them as human beings. They need somebody to take care of their whole body and soul. They need to feel better, to act better, to function better, and to live happy and long. Today, I'll be talking about a problem that has been always in the classic medicine, a big hole which cannot be bridged. It's a PCOS problem which affects many women all the time in their life. 10 out of 100 women suffers from PCOS. It's a very common disease and we call it syndrome because it entails a lot of details, lot of symptoms, lot of sequelae of these symptoms. So the life changes because of PCOS. Being an integrative doctor, I like to deal with every single cell in the body, not just the cell, the emotions and the soul as well. So having a problem with PCOS, not only hormones and functionality and infertility happen, a lot of other things as well as additional weight, which is very difficult to shed away. So when a patient comes to me with PCOS, we consider a lot of things together. How much she can do, how much she can change in her life, in her daily activities. It doesn't just, it's not only like a diet that you need to change or some supplements that you need to take. There is much more into that. Emotionally, we have to control the stress that comes with PCOS, with a lot of changes that reflects on hormones because of it. So for example, with the stresses in PCOS, cortisol is sky high, which is the stress hormone. And I always tell my patients, your stress hormone is stressed. When it is stressed, it causes you to crave carbs, it causes you to add weight, it causes the waist area to be always a problem, adding and not able to shed any grams from there. It causes insulin to be resistant, and consequently cells have sugars going through in the blood and they are not responding, they are not using this sugar. So how to sensitize the cells to be responsive again to your insulin, how to eat in a way that controls the inflammation in the body that happens with PCOS, how to raise the level of your functionality and feelings and metabolism and combustion and a lot of things that is disturbed because of the disturbed hormones. That's what we adjust in PCOS on a monthly basis with my patients. So the diet has to change in a way that is achievable for you to do, and at the same time it helps to decrease the inflammation, the background inflammation in your body. We need to adjust the hormones, which is a big entity, entails a lot of things. So your cortisol, your testosterone, which can cause acne, which can cause hair growth on the face, which can cause you to be disturbed in so many ways. the DHEA, the cortisol, the estrogen and progesterone, a lot is considered and a lot has to be worked on. So it's a lifestyle change, lifestyle modification, activity change, diet change, all have to be something that you can apply and don't struggle to do. So some supplements that is available can help. Emotional support that we offer can help. We do have a lot of programs that I put together for my patients to increase the efficiency of their body, to burn their food, to stop the craving, to have better fertility, to control their hormones back to normal, and to help a daily life to be much easier and happier for a PCOS patient. So Inositol is one of the supplements that I use frequently. Coenzyme Q10 is one of the things that increase the powerhouse inside the cell, which is called the mitochondria. There is a lot of adjustments for the testosterone and estrogen. So we have a lot of bad estrogen, which cause people to have insulin resistance, or we do have like the disturbance in the hormones together. So we give certain supplements like estrogen, for example, or we need to sensitize the cells for the insulin. So we give reactive chromium, and we can give something called dioxinol, all of which we have tried and found that there is difference. Probiotics, for example, gut health, to make sure that your microbiomes are acting in a proper way. They are not causing the bad microbiomes to crave more carbs or crave more glucose. When you have enough, we can just help the microbiomes to act properly, eat the good stuff, and use what you eat as well. So low glycemic diet is one of the things that I highly advise my patients to. I know that people who have been on diet for a long time had this yo-yo effect of losing weight and adding it back. So the best thing would be to prevent the yo-yo up and down loss of weight and regain. We do this by increasing the capacity of the cell to use the food, to do the metabolism properly, to assemble things together. All is needed by the micronutrients, the evaluation of the nutritional background. We do have tests to order for that. Certain things that you eat and you might never think that it is increasing your insulin sensitivity, or it's potentiating your glucose intolerance. When we check the blood or the urine for the nutrients or for the hormones or for the bacteria in the gut, if you have any infections that we need to treat, like fungi or mold or parasites, it's a collective thing. We have to fix all the body, not just the ovaries, which people keep concentrating on. Oh, the ovaries are not working. Well, the ovaries is part of the body. And when you go to an OBGYN, the focus will be the ovaries. When you go to a general doctor or a conventional medical doctor, the focus will be on the insulin resistance. They're going to give you metformin. They're going to give you something to try and lose weight. But there is so many other things that need to be fixed in the same time. Thank you so much for joining me today. If you have any questions regarding my talk or regarding this important topic, the PCOS, please leave your comments below, and we will be more than happy to help you anytime. Thank you very much.